the only thing, to me, the most compelling explanation for what you're talking about is if a child is born into this world and they come up through an educational and culture process, which basically says, hey, we don't know why you're here. We don't know why you as a human being have life. As best we can tell, it's all just a random accident of quantum physics and chemistry. And there's no greater purpose to your existence. Live the best you can out of this life and know that there's nothing on the other side. When somebody's born into a society that essentially affirms that this is all a meaningless exercise and a slow march toward a grave on which there's nothing on the other side, you set a young person up to live a life of despair, no matter how much they've got. And to me, that's the root of it.
Right.
Which is what makes this that we're doing so incredibly important.
Well, as we're going down to Austin today to meet with some people, what are your goals for that and just the story you were about to share earlier?
So when I had the privilege of serving as the opioid chairman in Kentucky, one of the things that I felt we needed to do was to look for the opportunity to create a therapeutic breakthrough for opioid dependency. Right now, we have two treatment options that don't resolve root physiological dependencies on opioids. You have abstinence treatment, which requires that a person cold turkey themselves, and only about 7% of folks make it through that process long term. Our alternative is the delivery of opioid maintenance treatment, where through methadone and Suboxone, which are opioids, you give an individual the medication at a dose that is lower than what they have used habitually. And you hope that this will restore them to a degree of functionality that lets them get on with their life. And while it has been a very powerful and effective treatment for many, and one that should always be available, studies have demonstrated that retention within both Suboxone and methadone treatment is low. And that when it comes to compliance with the treatment regimen, methadone, which is the better option of the two, has about a 25% success rate. So the very best of what we're doing fails about 75% of the time because of the compounding nature of opioid dependence, overdose, and the despair it produces. Creating that therapeutic breakthrough was, for me, job one. So in July of 22, I reached out to an author who had written about her own personal experiences with psilocybin mushrooms and the way in which they had helped her overcome a lifetime of mental health issues, the greatest of which was a near fatal eating disorder that she had. And she wrote about her experiences so beautifully. Her name was Julia Christina was her pen name. I reached out to her and I said, hey, here's the job I've been given. What can you tell me about whether there's anything within the world of psychedelics that might have application to opioid dependency? And she asked me if I had ever heard of Ibogaine, and I hadn't. This was on July the 29th of 2022. She said, well, I want to ask you to get in touch with a lady named Juliana Mulligan, who lives in New York City. She's going to tell you about Ibogaine. So I reached out to Juliana, told her who I was, and I said, I've been sent to you with a request that you tell me about Ibogaine. Juliana proceeded to tell me about her 10-year addiction to opioids that began with heroin. And essentially, she had lived for years in and out of jail, had been homeless on a couple occasions. And she said, I tried every treatment that was available to overcome this problem, and none of them worked. She explained that she had gone to a Suboxone clinic, and she said, what they don't tell you when they give you Suboxone is that if you try to take yourself off, the withdrawal you're going to experience is worse than any withdrawal associated with any other opioid you can get your hands on. And she explained that her withdrawal from Suboxone made her heroin withdrawal look like a cakewalk. She said that she became so tired and fatigued with the lifestyle that she had in the United States to obtain supply that she moved to Colombia, where she taught English as a second language classes. And Colombia has open pharmacy. And she said, I could go and get whatever I wanted, as much as I wanted, without any problem. She said, I lived this way for about a year and a half. She said, one morning I woke up and looked in the mirror, and I could just tell that I was going to die. And she said, I was desperate to figure out if I could figure out a way out of this. And I got online and started researching, and I came across this substance called Ibogaine. And she said it sounded too good to be true, but I was willing to try anything. And she made her way to a clinic in Guatemala. And she said, you know, what I didn't know about Ibogaine at the time is that it is a very serious medication. This is not a recreational party experience, and it comes with a cardiac risk that can be safely mitigated, but you have to screen people and you have to dose people properly. And she said, unfortunately, she made her way to a practitioner who did not adhere to safety practices that should have been in place. And she was given the dosage, and she went into cardiac arrest 6 times and almost died. She said that she woke up in the intensive care unit of a Guatemalan hospital. And she said when she opened her eyes, she felt the best she could ever remember feeling in her entire life. Not only did she feel the best that she had ever felt, she had absolutely no craving whatsoever for any opioid. And she came away with an affirmation that she is the child of an eternal creator whose essence is pure and unconditional love. And she was affirmed that she also has a special and unique purpose to achieve with her life. These were the things that Ibogaine provided her with. So after I spoke with her, I wanted to learn as much as I could about what this was, whether her story was shared by others who had had similar experiences, and whether I could build an empirical case to convince the Kentucky Attorney General to let me take a small portion of the state's settlement to fund Ibogaine research and development. I went on what was essentially a 6-month full-time odyssey, separate from my regular full-time job, to learn as much as I could about Ibogaine from all of the foremost academic and medical researchers, from individuals who had received the treatment, who could tell stories about its impact upon them, as well as the family members of those folks who had watched and witnessed their suffering and the way in which that Ibogaine had transformed their lives. At the end of that process, I became 100% convinced that Ibogaine was the Manhattan Project opportunity I had been looking for Kentucky for 3 reasons. Through that intensive research process, I was able to distill 3 realities about Ibogaine. Number 1, it essentially resolves physiological opioid dependence in 36 to 48 hours with a single treatment, a process that takes at least 18 months of complete abstinence to begin to occur. An opioid-dependent individual's brain cannot produce dopamine and serotonin absent the ingestion of escalating dosages of opioids. Dopamine and serotonin are the drivers of all of our most fundamental human survival instincts. And when a person is opioid dependent and is deprived of medication, behavior which appears to be depraved criminality is actually behavior that is the result of a profound neurochemical brain injury that is manifest by the shutdown of the brain's dopamine and serotonin production. Ibogaine restores that dopamine and serotonin production to its pre-opioid state in 36 to 48 hours for 80% of people who receive a single treatment. That result goes up to 97% with a second supportive dose. So you have a physiologically restored individual whose neurochemical brain injury has been cured by this treatment. In conjunction with that, there is a psychological restoration of the human being. According to people who have received the treatment specifically for substance dependence, they say that after an Ibogaine treatment, their life and their future is one in which they believe they have full and complete ownership and control, and that their life will be one that will be defined by their choices as opposed to their compulsions. And for an individual to have a sense of agency, ownership, and control over their future, we could not give them a greater asset with which to work out their own recovery than that, except for one, and that's the final Ibogaine attribute. Ibogaine has the ability to affirm the spiritual significance of the individual who receives that treatment. And it does so by affirming for them that they are the child of an eternal creator whose essence is love, who also has a special and unique purpose for their life. That concrete knowledge by the individual who receives an Ibogaine treatment, for me, is its most powerful attribute, and the one which confers the greatest sense of restoration, hope, and faith for a better future that can drive them out of what had been their imprisonment to addiction. Having been persuaded by these realities, with the blessing of the Attorney General, I announced that the Kentucky Commission would explore the appropriation of $42 million over 6 years to create a public-private partnership that would get Ibogaine through the FDA's approval process. Within this proposal, Kentucky's money would pay for FDA-approved clinical trials with Ibogaine, with the other half being paid for by a drug developer who would assume all of the legal, logistical, and financial risks associated with everything up to and including getting the FDA's green light to conduct these trials. The objective would be to develop Ibogaine as a breakthrough therapeutic for opioid addiction, as well as any other substance dependencies for which it demonstrated
including
efficacy.
alcohol. And
those include alcohol, they include meth, they include tobacco, they include behavioral addictions as well, which a person perhaps has developed by way of compulsive responses to trauma or other stressors. It is an all-purpose addiction interrupter. It is not an end now and forevermore, but what it does is give the person the best possible opportunity with the restoration physiologically of their mind to pursue a different course for themselves.
what is the success rate now of the Ibogaine as best we know?
The greatest metric of success rate is that 80%, 97% figure I gave you. Observational studies demonstrate that for opioid-dependent individuals, Ibogaine fully resolves symptoms of withdrawal and craving for 80% of folks with a single treatment in 36 to 48 hours, and that number goes to 97% with a second supportive dose. Those numbers are replicated, according to clinics, for meth, something for which there is no effective treatment.
That is 300% more effective on the first treatment than any of the others for opioid addiction.
That is correct.
And there is nothing for meth, really.
That's correct. There is no effective medical treatment for meth. But according to best practices clinicians who treat individuals who have a combination of opioid and meth addiction, it is equally as effective for those two combination substance dependencies. What makes that significant is within the street economy, the combo of choice for the distributors of our current misery is fentanyl and meth, because it is the most high caliber and potent addictor and killer.
And now that it's not moving forward in Kentucky. We have an opportunity to do this in Texas. I think a very good opportunity with the team that we've assembled in Texas. Um, where do you see everybody's role, and what are you trying to achieve out of today, and what do you see being able to achieve in the timeline?
As we on this plane down to Austin, it is my hope that the decision makers within the state, those decision makers being the governor, the lieutenant governor, legislative leadership, and all of the Texas legislators who would form a majority to support the creation of that very same partnership for Texas as we begun in Kentucky, that they understand that we're not here to ask for anything. We are here to offer a fabulous opportunity for the Lone Star State to put itself in the pioneer position to create a therapeutic that has breakthrough application to the greatest public health crisis this country has ever faced, as demonstrated by record-breaking deaths of despair as measured by drug overdose, alcohol-related disease, and suicide, three conditions for which Ibogaine demonstrates powerful therapeutic restoration. Not only can it address this public health crisis that is in Texas and across the country, but based on what we now know about Ibogaine's regenerative potential for the human brain, Texas stands ready to become the center of developmental gravity for all of Ibogaine's advanced neurological applications to injuries and conditions that impact the brain for which there are no current effective treatments, those being traumatic brain injury, Parkinson's disease, multiple sclerosis, and Lyme disease. If Texas takes the leadership role that its character and people seem proper to assume, it is going to help create a revolution in neuropharmacology that will lift up and improve the lives of millions of people generationally.
And on a best practices stage, you have seen, or there is belief that Ibogaine allows brain matter and improvement in the brain,
That is correct.
where nothing else is doing that. Do we see it also with dementia or Alzheimer's patients? Has there anything on that?
There has not been an application that I'm aware of to individuals with dementia or Alzheimer's with Ibogaine. That is one of the things that what we're going to do here now will hopefully foster. If we establish a beachhead in Texas for the performance of FDA clinical trials with Ibogaine, that is just but the first of what will be several steps forward to apply it to a host of other conditions for which it could demonstrate potential. And the fact that we know Ibogaine has regenerative properties within the brain and that it could perhaps have regenerative therapeutic application to individuals with dementia and Alzheimer's reinforces the necessity of accelerating research and development as quickly as humanly possible.
And I definitely could see the great state of Texas participating in it. I think it has the medical complex and infrastructure in which to administer that. Those FDA trials can definitely be administered and has the infrastructure to do it.
When I pursued this in Kentucky, we literally were riding on the public support that was being organically generated around the project as people came to understand what this was through our public hearings, as well as the indispensable support of then Attorney General Daniel Cameron to allow me to get this going. What we faced were two significant headwinds. The first was the University of Kentucky and its Center for Drug and Alcohol Research, which opposed this initiative every step of the way. And it did so because many of the researchers within that organization are funded by the pharmaceutical companies that manufacture opioid maintenance treatments. And they mobilized themselves in opposition. A lot of folks within the public health system establishment in Kentucky opposed it for similar reasons, not necessarily because they were funded by those researchers, but because they were genuine good faith believers that we didn't need to do anything more than we already were and we should be satisfied. I just happen to disagree with that. In Texas, there is a boldness of spirit that is willing to take risk, that is willing to explore avenues to create progress, and among the Texas Medical Center in Houston, which is fabulous, the University of Texas at Austin and Dell Medical Center, Baylor University, Texas Tech, and others, which are top-notch research universities and locations. There are an abundance of facilities and clinical infrastructure there to virtually guarantee the success of this if Texas will grab it with both arms.
And I believe Texas can grab it with both arms. The hardest thing in Texas is getting everybody to understand it so there is no fear that it is a recreational drug or some type of substance in which people will abuse. Properly used, I think Texas will fully support it.
Well, those are easy explanations to give as long as the minds and ears are open and willing to hear. And you've just nailed you've nailed the first fundamental reality, which is there is no recreational purpose for our Ibogaine treatment. This is a serious medication that has to be administered in a clinically controlled medical setting. There is no place for it outside of the walls of that clinical setting. It needs to be done with a physician, with appropriate cardiac monitoring and care that is offered at the same time the person is receiving it. And as long as its very specific medical application and effect is understood, I think we can overcome those other sorts of stigma issues that perhaps exist around other substances.
You know, I find helping in this very important. I've been a real estate developer basically all my life and an entrepreneur. I own several different real estate developments. I own commercial and residential rental property. I've been in the mining business, entrepreneur in various industries from mining to medical technology, large developer of self-storage, do quite a bit of housing, home building, and land development, as well as I own some bars and nightclubs and some other businesses across varying industries, including manufacturing here in the United States. And through that, I've seen a lot of people that have struggled with alcohol addiction, especially growing up in the South in Alabama. We have, the opioid and meth has run crazy, especially in North Alabama. And none of the treatments on the books now really have any effect or work. I watch alcohol destroy some very otherwise intelligent people. And I've seen quite a few people take their own life through either drug overdose or just total despair from their current situation and dependency of different substances. And those dependencies have created extreme financial heartbreak and extreme financial distress, and they just don't have a way out. And the current medical system doesn't provide it. And I've been quite blessed both financially and in a lot of ways that I'd like to see this opportunity for the state of Texas to actually really have something that becomes changing in order to run the trials, to get an understanding of everything that it can be done, not just for the depression and for the drug and alcohol and other addictions, both life addictions and substance addictions, but to also understand what it can do for the brain injuries, and other brain diseases. And I'd like to see that happen, and I believe that we can get it done during this session.
Well, I thank you for being who you are, for having achieved what you have with your life so that you are able to get in and make an influential difference. And
I think our entire board is consistent of people that have been successful and made a hell of a difference in business, and it's time to get together and do something a little different.
Well, I'm very glad to be able to join y'all's company on this mission, and I'll do my very best with y'all to get it done.
Yeah, we will get it done.